Hello everyone, my name is Janine McNesh and I will be doing my professional practice model on VCU Health. VCU Health is very near and dear to me because it is located right across the street from my nursing program, which is at J. Sargent Reynolds Community College. It is located in the heart of downtown Richmond. Currently, it has about 65 facilities and affiliates, and that includes all across Central Virginia. Um, it has over 200 different specialties, which include cancer, heart and vascular, also genetics, as well as neurosciences and transplants. In 2005, about 30% of patients stated that they actually traveled outside of the greater Richmond metropolitan area. They are in fact a teaching school, so they have about 5 different schools. So whenever you get the chance to visit VCU, or if you've ever been to VCU Health, you've probably seen the medical students kind of scuttling in the hallways, trying to apply what they learned in lecture into the actual clinical practice. VCU is actually one of only 2 NCI designated hospitals or centers in Virginia. They have about 865 beds, and they are the only level 1 trauma center in the region. So they often accept really critically ill patients from neighboring hospitals to be treated there at VCU Health. Now, for VCU Health, their professional practice model, or PPM, is actually based around the nursing process, or a huge foundational component of that is. If you go through their mission and also their statement for their model, they actually use the ANA, the American Nursing Association model, and they kind of break that down, and they have about 15 standards of practice, professional practice within their nursing. Of course, within their nursing practice, they have assessment, diagnosis, outcome identification, planning, implementation, and evaluation. I thought that was really awesome because they actually took it back to the basics, and they allow us to still utilize that nursing process and show the importance of having that throughout our nursing career. As I stated, they have about 15 standards of practice, so that was about 6 standards of practice. The next 9 standards of professional performance include the quality of practice, education, professional practice evaluation, collegiality, collaboration, ethics, research, resource utilization, and also leadership. I think that most hospitals usually have a broad scope of their professional practice, mainly so they can be able to kind of integrate a whole bunch of different examples or different scopes of professionalism within these standards. For VCU, the quality of their practice. They believe that nurses and also medical professionals should be giving their absolute utmost quality services to their patients. Just like the ANA, all patients deserve quality of services, and that's something that VCU Health stands by as well. Also education. They are a teaching school. They have 5 different schools there at VCU Health, so they do believe in the power of education and continuing that education beyond just graduating nursing school or medical school. They have a lot of professional development that goes within the facility as well, to help facilitate that. Professional practice evaluation. They believe in providing quality of practice. They must continuously evaluate themselves and how they provide services to the public or to their patients. In doing so, they always try to do better than they did that patient before them, or on every clinical basis. VCU Health also highly regards or take in consideration teamwork. So with teamwork, you're working on a multidisciplinary team, and they believe that working together actually provides that quality of service to the patient and their families. Open communication amongst the different medical professionals. No one is, more important than the other. It's all a part of a well-oiled machine. Collaboration goes into that teamwork as well. Ethics, providing quality services also means adhering to ethical standards as well, and that applies to the research that they have. Research to try to dive into the unknown, try to seek solutions for problems that we have within healthcare, whether it's cancer research or within neurosciences. VCU has always tried to extend that research, but also adhere to ethical practices within that research as well. Resource utilization. VCU is really great at utilizing resources, whether they collaborate with other hospitals or they make sure that they collaborate with the best within the nation, within the country, within the world, as far as that research, as far as the treatment for their patients, to make sure that they're providing the most quality for their patients. And leadership. As far as myself and my experience with VCU Health, they have provided the utmost professional leadership. They hire the best. They expect the best from their medical professionals, and they expect their leaders to go up and beyond and have that autonomy and be able to speak up and be the advocate for their patient as well. All right. Now, I think that VCU Health's PPM is pretty broad. When you kind of go through their mission and also the professional model, they state, specific characteristics or bullet points, but they don't really dive into it. So it leaves it open for multiple interpretations. So that could possibly be a problem, and maybe that could be something that they look into as far as identify specifically what the quality of practice means from the VCU Health culture. I do think that within their scope of their PPM that they do deliver a holistic patient care. They talk about quality, but also if you dive into the mission of their care, they talk about treating the patient as a whole, and I definitely believe that that goes into the holistic statement or the holistic characteristics that we're looking for. PPM, it does promote highly autonomous decision making based upon the information that you have, decision making within the team and collaborating with the team. So I do think that within their within VCU Health's PPM, that they do try to involve the patient, the family, other team members to facilitate the best treatment for their patient. But overall, VCU Health is a great facility. They have a model in place in which I feel like, from my experience, just viewing them from a clinical perspective, but also as a patient, that they embody that professionalism, and they integrate their PPM within their daily healthcare experiences, but also services. Thank you.